Good morning, staff and parents. We want to come to you this morning with just an update on some things that we thought we had a plan, of course, and then yesterday we met with the health department and we're having to make a few changes right here before we start school. But I want to introduce Miss Christy Anderson is joining our team. We're very excited to have you. She'll be working with HR and doing COVID safety and safety throughout the school. So we're excited to have you join our team.
Excited to be here, thank you.
Everybody knows Kate Brooks. She's over school health, and so we take a lot of advisement from her in the health department, so appreciate you being so supportive to us. And then we're really excited about Miss Katie Stefanelli joining our team at the middle school. So welcome aboard, Katie.
Thank you.
You know, what's the old saying that man has a plan and then God smiles? Well, so yesterday we had a meeting with the health department, and of course I think everybody's aware we've seen a little bit of spike in COVID cases. Our goal had been all along was that we were going to open schools more back up, let parents come in. That's been my goal all along. As a parent, I was excited about that as well, but after meeting with the health department, we're going to have to make some tweaks and go back to pretty much where we ended last year, and we want to tell you why we're doing that. So Kate, if you want to just kind of give a summary about what's kind of going on in our meeting that we had yesterday.
Gotcha. So unfortunately, it does appear that we are not going to be able to allow a lot of parents, outside visitors within the school, just to hopefully keep down the rates of transmission and to keep as many bodies out of the school as we can. Masks are still going to be optional within the school. Right now, for ages 12 and up, we have a big push for vaccinations to try to hopefully reduce the rates of transmission.
And some of the biggest changes that we were looking at was mainly the first day of school. We were looking, K-5, letting everybody bring their kids in, welcome to class. So we're going to have to do pretty much exactly what we did last year. We'll have to stop at the door. The primary school will be putting out updated information. There may be some information that already went to print at the newspaper that we're going to have to change because we had this meeting late yesterday afternoon. So just be looking for those changes. Open house, new teacher orientation, we're going to still keep that the same. I think K-5 was doing that by schedule. Now 6-12 will have to do some adjustments on theirs, so they will be letting you know that information will be coming up soon. I do feel like I'm going to talk with the primary school and probably elementary. I know last year it was where if you could bring your child up there to make sure over the weekend at some time to make sure they knew where their room was. We're going to have plenty of staff available. Actually, last year when we did this, it worked out really well how we set things up. Again, I apologize. We thought we were going to be able to open back up, but what really hit home was that if we open up and let everybody come in there, there's a good chance that a lot of our teachers will be exposed to COVID and they will come down with that, and then that could cause us to have to shut school down or make some really big adjustments, and we just can't. That's just too big of a risk. We have to make sure that our kids are safe, and we also have to make sure our staff is safe. I know Christy's came on, Miss Anderson, and she's going to talk about a couple of safety things that we've also done.
Yes, thank you. We have, working closely with the maintenance department here at the school, we have plenty of sanitizer. The teachers are prepared. We did a good job last year as a school district, and we hope to continue that on this year. We are going to open up the water fountains this year. That was a recommendation. So if you would like to send your student with a water bottle, they will be able to use that, but the water fountains will be back open. Each school also will have a safety team that will report back, and we will work as a group and figure out everything that needs to be done to keep our students and staff, teachers safe.
And talking about that, the length of time, we're going to evaluate this. It may only be 6 weeks, 9 weeks, and we can adjust as we go. Hopefully it's going to be a short amount of time. I know Ms. Anderson talked about the water fountains. That's the recommendation that came down through the health department because we're going to be cleaning them, and they're saying the virus does not live very long on high-touch surface areas, but we will continue cleaning those areas. So this recommendation to limit the exposure did come from the health department, and we do want to take their advice on that. Now the other thing is vaccinations, being vaccinated. Do you want to speak on that real quick?
Yeah, so we do have a list of the different entities in Taylor that are providing the vaccinations. Certain companies have different vaccinations based on, you know, which one you'd like to get, and then there are also certain locations providing vaccinations for those 12 and up. So we can put a list of those on the school website and on social media. Coming from a nursing standpoint and being in the clinic last year, having gone through this, I just want to say I do feel like our schools did an excellent job of controlling the rate of transmission, and we honestly are even better prepared to deal with it this year.
You know, we really kept sickness out of our schools last year, and I think that's the hard work of our staff, the extra cleaning we did, and limiting visitors in the schools. So I think that helped keep a lot of sickness out. As far as being vaccinated, I know people on both sides of that have different opinions. I personally have been vaccinated myself. What we're seeing and what we're hearing with this second round is it is harder, or it can be, on younger people. So I just beg you, please get vaccinated. I know they're saying that like 99% of the people who are in hospitals right now have not been vaccinated, and we're seeing young people around our age getting this, and they're having tougher times with the symptoms. So please, if you're thinking about it, please go ahead and get vaccinated to take care of yourself. We don't want to lose anybody in this county to this terrible virus. So, but I want to thank y'all for coming and helping us make this video. Parents, I really apologize. We had a total different plan ready to go. You'll probably even get to see it being printed in the paper, but we had to make these changes off the recommendations of the health department. So just know we love you. We're really excited to see the kids come back. And so if you have any questions, get with the schools, and we will try to answer those questions. So thank you, and God bless.